Usually the time spent with my guest is audio only. I'm listening to him interview people for Axel. It is so nice to be standing next to Magnus Ohman, MD, Associate Director at Duke Heart Center and Senior Investigator, Duke Clinical Research Institute. I can see you and I can hear you. I really like this a lot. The ACC and the AHA and various partners have released a new focused update of the guideline for the diagnosis and management of patients with stable ischemic heart disease. I guess the first question is, why now for a focused update?
Well, first of all, you have to remember that all our guidelines get updated intermittently between sort of major rewrites because science change. In this particular case, there were a number of things that either were left out or we felt that we needed to sort of update with new information. Typically, it takes us about a year and a half to write a guideline, and science is never standing still. So we need to get in and get those things in. And there were a few things in these guidelines that were not included in the original publication that we needed to add in.
So what's new?
Well, a couple of different things. Many of our viewers or readers may not remember this, but we used to have a guideline for diagnostic cardiac catheterization. That went into the PCI guidelines, but there were areas there that were not covered in the revascularization or PCI guidelines. So we ended up putting some of those things back in. So for example, the idea that you may want to define coronary disease in patients that you are suspicious of, but that don't fill all the other criteria. So it's reasonable to perform cardiac catheterization to detect coronary disease or to exclude coronary disease in some settings, and that is one of the things. I think that's important because the ongoing ischemia trial is using CTA, so CT angiogram, to exclude left main disease, and there are times where excluding really high-risk features is important for the patient's well-being.
So what else? I know there's some new considerations regarding enhanced external counterpulsation, which has been around for a while.
Yeah, there wasn't so much new data. Other than that, there's been some publications, some registries that was really much larger than the randomized experience. And the writing group felt that it was important to include all the data to sort of give a broader perspective on this therapy that is used actively in the community. No real change in the recommendation, but we just enhanced the information that was available.
Obviously, you're still referring to GDMT, which is Guideline-Directed Medical Therapy. All the guidelines now are focusing on trying to use that acronym, correct?
That is correct, and obviously the emphasis is for patients to take the right therapies and really in prevention of further events. The other part that we included was chelation therapy. This had been in the guidelines as a sort of warning, maybe shouldn't be done, but then we had the TAC trial. It wasn't particularly positive, it was borderline, as you'll remember. But some subgroups, particularly the diabetics, had some important information. So the committee felt that it was important to at least bring that up to date and to include it, because that's another practice that's going on in the country, and that we felt that we are aligned with what's going on in the community.
I mean, we're used to the heart team concept, which is actually required in things like TAVR. You're focusing on the heart team a little bit in this guideline. Why the concept of heart team at this basic of a level?
Well, because we realize that there are many patients that are complex. We have patients with multivessel disease and diabetic patients. They should probably have coronary artery bypass grafting. But there are patients who are really too old for that. They have comorbidities. And so having this dual decision point, I think, is really helpful. It is recommended in the revascularization guidelines. We added it back in here to the stable because it's as relevant in this population as all patients with coronary disease. And I think it just emphasizes collaboration, and teamwork always works better.
Is there anything else besides the fact, first off, that we should mention that the guidelines are really easy to use? They used to be very complex things, but they've really been streamlined.
I think they're getting much easier. Now, this update is sort of a little bit out of sync with the overall guidelines, a little bit more complex maybe, but the reality is that the update falls in. If you go on electronically, it's actually already in there now, and so you don't have to search for two documents, it's all streamlined.
And this is now available, so please, if you have an opportunity to check out the focused update of the guidelines for the diagnosis and management of patients with stable ischemic heart disease. And for Cardiol Source World News, I'm Executive Editor Rick McGuire.